turn this off. And we'll see.
Should we turn our videos off too?
It's up to you. In panels where we have a lot of people presenting, we've been asking people to turn their cameras off if they're not presenting, just to preserve bandwidth. If it does just end up being the three of you.
It will.
Oh, here as well. Hi. Then it shouldn't be an issue.
We have a couple more from Urban joining.
Okay.
Yeah.
Great. So we're just waiting on Katerina. She's last in the program, so hopefully she'll be able to join in progress. So we're going to go in the order of the program. For people coming in, if you have any questions, please feel free to post those in the Q&A box at the bottom of your screen. I will relay those to the panel at the end, so we'll save all questions for the end. Everybody has 10 minutes, and so I will jump in, or try to remember to jump in around minute 9, just to give that 1 minute warning. And so nobody came here to see me. We wanted to get to the work. So yeah, our first paper is up, and so I will turn the floor over to you guys whenever you're ready.
All right. Well, welcome everyone. Today, my name is John Heidt, and today my co-author and I, Johannes Wheeldon, are going to be presenting on a paper called Data, Damn Lies, and Cannabis Policy, Reefer Madness, and the Methodological Crimes of the New Prohibitionists, kind of a mouthful. Just before we get going, I want to point out this paper has been accepted for publication. It's in the final stages of the editing process. It'll probably be out sometime next year in the journal Critical Criminology.
Well, good afternoon, everyone, and just a special shout out and thanks to Will and the team for putting the conference on and giving us a chance to share this work. Let's get going.
So I think most of the people watching this probably are well aware that the status quo of cannabis prohibition has been kind of a disaster. We spend a great deal of taxpayer money to enforce these laws. They really have little effect on rates of use or availability of the drug. Some studies suggest that enforcement of drug laws has actually distracted the police from enforcing other more serious crimes. Arrests are also disproportionately imposed on people of color, and this results in a wide range of social and psychological issues and costs. Some say that cannabis laws are rarely enforced, but this really isn't accurate if you're a minority. They tend to be enforced fairly consistently if you're a minority. Now, there's this fairly widespread consensus that cannabis ought to be legalized, and Canada has already done this. And just a few weeks ago, several more US states have also legalized it for recreational use, even South Dakota, which tends to have rather draconian drug laws.
So perhaps unpredictably or predictably and unsurprisingly, as states and countries have legalized cannabis, we've seen a backlash. And most recently, in the pages of the New Yorker, no less, that August publication, Malcolm Gladwell repeating some very odd and unfounded findings by Alex Barrison and other researchers, argued and continue to argue that cannabis legalization will result in higher rates of violence and more crime. And so what we see is the amplification of either dodgy science on the one hand or misrepresented views on the other, finding their way into the discourse and discussion.
So building on some of the stuff Johannes was talking about, we kind of have this new breed of prohibitionists come around lately, and they're a bit different from what we've seen in the past. They've evolved. So when you see them interviewed and you read their writings, they appear to be more, science-based rather than just based on, their ideas are based on fear and scaring people. Some of these commentators will also mention that they've smoked cannabis in their youth, implying that they have this experience with it and they kind of know about it. So the preferred policies that stem from this commitment to science are a bit different in comparison to the old guard of prohibitionists. More specifically, new prohibitionists believe in treatment-based approaches. And this might sound nice, but it can actually be quite coercive in certain situations. So this means that they reject punitive approaches and the moralistic arguments that we heard so much of in the 1980s and 1990s. And interestingly, many say that they prefer decriminalization to prohibition, but not legalization of marijuana. And so this makes them appear somewhat progressive on their face, but in reality, they're kind of just committed to preserving the status quo.
And as John was pointing out, a wolf in sheep's clothing is still a wolf. And the challenge that we have is that the status quo is deeply problematic and harmful to numerous populations. So what we looked at in the paper in detail is sort of tracking the methodological crimes and misdemeanors that are used in the research among the new prohibitionists. And I won't go into great detail now, but I'll just highlight a couple. The first is around the selection of studies that they focus on. They tend to focus on case control studies in psychiatry. They tend to privilege anecdata from psychiatrists. Armed with those findings from those sort of limited studies, they then go on to try and draw causal inferences from variables that do appear correlated, but don't really establish a link. And the big problem here is that if you think about variables involved with cannabis use, mental illness, and crime itself, you have a number of variables that overlap.
So the crux of the new prohibitionist argument against legalization is that more cannabis use is going to increase mental illness and especially psychosis and psychotic breaks, and this will lead to higher levels of violence and crime. And I should make clear, as Johannes was mentioning, there are psychiatric studies that suggest a correlation between heavy cannabis use and mental illness. The problem is that they never specify a causal mechanism. They talk about these correlations all the time. Further, when you examine other types of studies in other fields and disciplines, the connections to crime tend to break down. I mean, areas that have legalized cannabis haven't really seen increases in violence and crime that could be attributed to this policy change. In fact, some studies have actually found decreases in crime for various reasons, and we can discuss these a little bit later. Finally, every criminologist has heard of the crime rate drop during the 1990s. I mean, this is really well known in the field, and it's been fairly well studied. I mean, we have to consider that this overlaps with a period in which cannabis use became increasingly normalized amongst young people and adolescents. So you would expect, you would expect to see a rise in crime based on those factors. That's assuming, crime responds to one factor by itself. So who? I think everyone kind of enjoys irony. I know I do, and I'm going to just illustrate this with kind of a rhetorical question. I just want you guys to sit back and kind of imagine yourselves during alcohol prohibition. I mean, what do you think people were drinking during alcohol prohibition? What was the popular drink, the easiest thing to get? I mean, beer might pop into your mind. I think people mostly prefer beer now, or maybe wine, but that really those really weren't popular during prohibition. They were too expensive because they're just too bulky to transport to be profitable. So most people were drinking hard alcohol because that's what you can make money off of. We can see a similar pattern with drug criminalization. We get stronger, cheaper drugs that are more readily available. I don't think that was the initial goal or the ultimate goal of prohibition. And so this tendency of drugs to get stronger when criminalized is known as the iron law of prohibition. If you guys think about it, you can probably come up with a few examples if you consider how drugs have evolved in the last 50 years or so. If you just think about the news, heroin and fentanyl, it's evolved kind of in that direction. Fentanyl, of course, we know is very powerful. Now, the new prohibitionists are always concerned about, well, this is the ironic part. The new prohibitionists are always concerned about high THC cannabis making its way into society and becoming more widespread because it's thought to trigger mental illness in some people. But this is exactly the kind of cannabis that emerges when it's criminalized. We have stronger strains now than we did 30 years ago. We have concentrates that are incredibly strong. And so you can kind of see how this iron law of prohibition plays out.
So I think what, the irony here is that the new prohibitionists are going to hasten what they seek to disrupt by continuing the status quo and the harmful policies that get associated with it. You're going to increase the thing that you want to reduce, and beyond being just sort of amusing, there are some serious consequences associated with this. So in the paper, we sort of trace the backlash and argue that the new prohibitionists sort of pursue a new moral panic. And they do so, as John said, in new ways perhaps, but really by fudging the evidence and by focusing on certain studies over others, and more importantly, ignoring the large body of research, which undermines their central thesis around the dangers of cannabis. And perhaps most importantly, they ignore or downplay the racial dimensions of prohibition and the widespread associated harms. So I think it's fair to ask with the election of Joe Biden what this actually means, what can be done by executive order, what will happen federally, and the impact such decisions will make. In the question and answer period, we'd really like to share some of our thoughts on a new research program that we hope could help elucidate and get at some of the underlying concerns that we need to address as we move toward cannabis legalization, with or without the support of the new prohibitionists. Thanks very much.
Thank you.
Thanks a lot, guys. Our next presentation is how could we reduce the incarceration by X%? Ben, whenever you're ready, the floor is yours.
Can everyone see that and hear me?
Yep,
Great.
you're good.
Hi, everyone. I'm Ben Grunwald. I'm an associate professor at Duke Law School, but I'm also a criminologist by training, so I feel very much at home with you all here today. Today, I'm talking about this project called How to Reduce the Prison Population by X%. And I want to start off with the caveat that it's really hard to present this paper in 10 minutes. It's like shamefully long. It's like 30,000 words long. It's 70 pages, and there's just a lot going on. And so there's no way I can walk you through, there's no way I can satisfyingly walk you through each of the steps of the analysis, what the data is. I'm kind of just not going to think about this as a traditional academic presentation at all. This is just like an academic teaser with the hope some of you might be interested in reading the paper. And if you are, please feel free to reach out. I'd love to share it with you. But the motivation for the paper starts with the observation that, while criminal justice scholars rightfully love to rail against mass incarceration and love to talk about how we need to dramatically reduce the prison population, which we absolutely should, I think despite the one concrete proposal on the table, which is the abolition of prisons, most of us don't actually have a concrete proposal in mind for what we think we should actually do to decarcerate. We don't know who we should decarcerate. We don't know how we should decarcerate them. And we don't know by how much we should decarcerate them. And so the idea for this paper is to try and start answering these kinds of questions. And so the research question is this: suppose we all agreed to reduce the prison population by some number, say 25, 50, 75%. Assume we agreed, how should we do it? And the paper tries to answer that question in two distinct analytic steps. The first one is to basically identify the universe of all possible decarceration strategies that would achieve each of these threshold reductions, 25% reductions, 50% reductions, 75% reductions. So identify the universe of all possible decarceration strategies that actually achieve these thresholds. And of course, I can't really do that in a paper, like the universe is too many. But what I try to do is estimate or forecast the effects of all of the ones that we probably care about the most. And so in the paper, I forecast about 200 different decarceration strategies. And I do that in part by grouping crimes together. So the National Corrections Reporting Program from 2016 is the data I use. This gives individual level data on prisoners in 39 states. And they group crimes into basically 13 categories. I regroup them into 5 broader categories: low-level offenses, drug offenses, other nonviolent offenses, less severe violent offenses, most severe violent offenses. And for each of these categories, I adjust the admission rate and the time served relative to the 2016 rates and project over time how many people are going to be in prison 30 years later if we make these changes now. That's the basic idea. And in doing so, I should say that I'm working on the backs and shoulders of lots of previous research projects, including a bunch of fantastic work done by people at Urban Institute. And I know some of them are here today. So that's part one. That is identifying which decarceration strategies would actually achieve these threshold reductions. But of course, once you do that, you realize there's just a ton of different decarceration strategies that could achieve each of these thresholds. And so if I just gave you a list of all of them, that wouldn't be all that helpful. You'd sort of be left wondering what we should do. So the next stage is to try and sort them, to try and give some order, to try and identify which of these strategies is the best one given our priorities. And so I offer 4 metrics that I think can be used to sort them. The first one is the most obvious. It's public safety. Maybe I shouldn't even be saying public safety. That's too broad. I should be saying more narrowly just crime. But this, of course, is the metric that's dominated, unfortunately, all of the conversations we've had about mass incarceration over the last 20 years. Every major decarceration strategy, while some of them have talked about other priorities, in the end, they have all focused almost entirely on crime rates. I think that's largely to our detriment. So there's a few more metrics I think we should consider when we're thinking about decarceration. One is the social harms of prison. Criminologists and legal scholars over the last 20 years have done a great job cataloging the massive social costs of prison, massive social costs to the prisoners themselves, to their families, and to their communities. And to the extent that we're going to engage in decarceration, I think one of the metrics we should use, or at least one of the reasonable metrics to use, is minimizing the social cost of incarceration for society. A third metric would be racial disparity. I mean, everyone here knows that people of color are vastly overrepresented in prison. As just one example, Black prisoners are overrepresented by a factor of over 3 in prisons today relative to the general population. And so while we're engaging in decarceration, one of the things we need to do is to work to decrease racial disparities. And then the fourth metric is timing. So, a decarceration strategy could happen over days, it could happen over months or years or decades. And to the extent that you think decarceration is good, you probably think decarceration should happen faster. Now, that's not always the case. There's lots of gray areas. There are some advantages to slower decarceration, including political feasibility. But on the whole, I think if you're in favor of decarceration, you probably want decarceration to happen faster. So those are my 4 metrics. And I basically apply these metrics to pick among all of the decarceration strategies that achieve 25, 50, and 75% reductions in the prison population, which are the ones that do best, according to these metrics. And with that, I'm going to skip. I'm not going to tell you anything about my data. I'm not even going to tell you about how I do these forecasts. I'm just going to tell you the results. There's just no way. I just don't have time to do all those things. So in the paper, like I said, I forecast about 200 different decarceration strategies. And here, just as an example, I'm going to look at what I call the best options, the best performers among those that reduce the prison population by 50%. So here's the baseline forecast. This is the forecast assuming that we make no changes to time served or admissions for any crimes based on the 2016 levels. And this shows you that, from 2016, flashing forward to 30 years later in 2046, the number of people in prison, if we do nothing, is going to be really similar. It's going to drop by a couple of percentage points, almost nothing. This also shows you that during that period, the average number of admissions per year in the 39 states for which I have data is about 500,000. And by 2046, Black overrepresentation in prison relative to the general population will equal 3.2. So let's compare that against a couple of the best options that I have personally selected to show you. But in the paper, I make lots of arguments about why these are the best options. But for now, you're sort of just going to have to trust me. And if you want to know more, I'd love to share the paper with you. So here's the first decarceration strategy I want to highlight. This is one of the ones that I think performs best in terms of public safety. And before I tell you about it, I need to tell you one more thing, which is the second you look at prison data, you can immediately tell that there's no way to reduce the prison population by more than 50% without decarcerating a significant amount of people convicted of violent offenses. And the reason is that because about 55% of people in prison are there convicted of violent offenses. So here is the decarceration strategy that I think performs among the very best in terms of public safety or preserving crime rates, and that's reducing time served for nonviolent and less violent offenders by 75%. Doing that, according to my models, would reduce the prison population by 55%. So I should say that's 44.5% relative to the baseline, which is why I'm saying it's a 55% reduction. So a 55% reduction in the prison population within 1 year. Here's another one. This is another one that I think performs quite well in terms of public safety or preserving crime, assuming that you want to reduce the prison population by 50%. This involves reducing time served and admissions for nonviolent offenses by 75% and less violent offenses by 25%. If you do that, according to my models, you get a 50% reduction in the prison population in a year. Let's take a look at one last model. This is one that I think performs really well against the metric of social harm, so minimizing the social cost of incarceration. This one focuses entirely on reducing admissions. It does so by reducing admissions for nonviolent offenses by 100% and less violent offenses by 25%. So in other words, eliminating incarceration for nonviolent offenses, reducing admissions for less violent offenses for 25%, Maybe I should have mentioned, when I say less violent offenses, I mean violent offenses excluding murder, rape, and sexual assault. So if you do that, you achieve a 50% reduction in the prison population, according to my models, in 15 years. So that's performing less well in terms of timing, but better in terms of social harm. And the reason that I say it's performing well in terms of social harm is because this is the strategy that reduces admissions the most to prison. The idea being that if the social costs of incarceration are disproportionately attaching at admission rather than by adding extra years onto the sentence, then we can minimize the amount of social harm by minimizing the number of people admitted to prison, and that's the strategy. This one reduces admissions by 78%. Okay, so I haven't yet said anything about the metric of racial disparity. So the reason is that it's the most complicated to talk about. So among all of the strategies that reduce the prison population by 50%, the one that reduces that performs best in terms of racial disparity is actually the first model I've already talked about. So you can see that by 2046, under this model, Black overrepresentation will equal 3.2, which is the same as it would under the baseline model. What that's telling you is that the best performing model among all the strategies that reduce the prison population by 50% that I test in this paper is the one that has no effect at all. The reason being that all of the other strategies actually exacerbate racial disparity rather than improving. And I don't have the time here. I have like 10 seconds left in my presentation to tell you more about all the reasons why this is true. But one of the major takeaways from the paper, from the 200 models that I run, is that it's extremely hard to decrease racial disparity through race-neutral decarceration strategies, particularly at the sentencing phase. And so in order to do that, in order to take that problem seriously, we either need to consider race-conscious decarceration strategies or think about decarceration strategies that happen at earlier phases in the criminal process, well before sentencing. With that, I'm out of time. Thanks very much.
All right, thank you so much for that, Ben. Our next paper is from the Urban Institute, assessing the reach and impact of the comprehensive opioid abuse program. Ben, if you could.
Yeah, I'm trying to take it off screen share.
I can get it for you.
That would be great, thank you.
First time today I've gotten to use that power. All right, whenever you're ready.
Great, thanks. Hi, I'm Janeen Willison, Senior Fellow at the Urban Institute and the Principal Investigator for the project that we will be speaking to you or with you about today, our initial assessment and evaluation of the comprehensive opioid abuse program. So just very quickly, give you a little bit of background on our project, which we'll hear more about the objectives of the work that we're doing. But just to share quickly, the Urban Institute, with funding from the Bureau of Justice Assistance, has been working to assess the reach and impact of the comprehensive opioid abuse program, which is BJA's signature initiative to assist communities in addressing the opioid crisis. Our work began in February of 2019. It's a 30-month assessment and evaluation in which we are documenting and describing the scope of the opioid epidemic, examining the range of strategies employed by COPE grantees to tackle the opioid crisis in their respective communities, including successes, challenges, effects, and lessons learned from those efforts. And what you see here on the slide today are the three key components of the study, which you'll be hearing more about, including the objectives of each of those study components and the questions that we're working to answer. And with that, I'll hand that off to Will, who's one of 5 team members you'll hear from today.
Thanks, Janeen. Yeah, I'll try to be quick so we keep in our 10 minutes and running through a number of folks working on this quite large assessment. So as Janeen mentioned, my name is Will Engelhardt. I'm a training and technical assistance manager with Urban Institute working on this assessment, and just want to spend a little bit of time discussing what it is that we are assessing, as I imagine a number of folks aren't familiar with the comprehensive opioid abuse program necessarily. So the Urban Institute, with funding through the Bureau of Justice Assistance, is assessing, as Janeen mentioned, the reach and impact of this program, the Comprehensive Opioid Abuse Program, or as we refer to it, COPE. Among communities, specifically, we're assessing those that received funding in the fiscal year 2017 and 2018. As Janeen mentioned, this is a 30-month assessment, and the purpose of the evaluation is to document and describe the scope of the opioid epidemic, which my colleagues will talk a bit about, and examine the range of strategies employed by various grantees. Authorized as part of the 2016 Comprehensive Addiction Recovery Act, CARA, that some folks might be familiar with. This is BJA's largest competitive grant award, and it included a total appropriation of $315 million, with awards made for the grantees that we're assessing in 2017 and 2018 to 216 grantees across state, local, and tribal entities in 47 states, as well as Guam. In these years of funding in 2017 and 2018, there were 6 categories of funding, 5 of which we were assessing, which are the first responder partnerships projects, technology assisted treatment projects, system level diversion projects, statewide planning, coordination, and implementation projects. And then the one that we're not actually assessing, prescription drug monitoring program, implementation, PDMP, and enhancement projects. And then finally, we're also assessing the 6th one, which is public safety, behavioral health, and public health information sharing partnerships. Since those 2 years, the program funding has changed a little bit, and some of you might be familiar with this, but they're now also funding projects aimed at addressing stimulant use and other substances of abuse. And the program is now not known as COPE, but known as the Comprehensive Opioid Stimulant and Substance Abuse Program, COSAP. Anyway, that was just a bit of background. My colleagues now are going to talk a little bit more about the assessment that we are actually undertaking. And so I'll kick it over to my colleague, Azhar.
Hi, so next slide, please. So I'm Azhar, I'm a policy assistant at the Urban Institute. I was part of the team that started with the first component of this project, which was drafting an interim report to Congress back in the spring of 2019. Overall, the purpose of this report was to summarize the scope, scale of the opioid epidemic as of that time, and also discuss the impact of the opioid use disorder in the context of the criminal justice system, as well as the epidemic's impact on health, well-being, and communities. Within this report, we discussed different justice-related responses, including various supply, demand, and harm reduction strategies employed by different communities. We also outlined the Comprehensive Opioid Abuse Program and other initiatives funded by the Office of Justice Programs. Within this report, we include a few takeaways, one of which is the importance of cross-system collaboration, which BJ has formed with other federal agencies, partly through COPE. And we provided a link to the report here at the bottom if you'd like to take a look and learn a bit more about the report. But for now, I'll also pass this along to my colleague, Colette.
Thanks, Azhar. Next slide, please. Hi, my name's Colette, and I'm a research assistant, and I'll be telling you all a bit more about the multi-site process evaluation, which spanned from September 2019 through July 2020. The objective of the process evaluation was to examine strategies, operations, and outcomes in 30 selected COPE and Bridges grantees, as well as to assess the impact of COPE and generate actionable information to inform future efforts. Next slide. So through semi-structured stakeholder interviews, program and meeting observations, and document review, we assessed grantee adherence to their intervention, factors affecting their implementation and performance, milestones achieved, any challenges encountered and solutions employed to address them, outcomes, and finally, lessons learned and recommendations for future efforts. Now I'll pass it off to Mari.
Thanks, Colette. Hi, my name is Mari McGilton, and I'm a research analyst at the Urban Institute. Next slide, please, Will. The third aspect of the initial evaluation of COPE is the analysis of the grantee reported information submitted to BJA through the Performance Management Tool, or PMT. Through this analysis, we sought to answer a series of research questions, which included the degree to which grantees met their reported requirements and milestones, grantee reported progress, outcomes, and challenges, and the effectiveness of grant activities on communities. Now, we did also seek to identify and understand differences between several groups, which included differences between grant categories, differences between grantees awarded in fiscal year 2017 versus fiscal year 2018, and between those grantees who participated in a site visit during the multi-site process evaluation versus those who did not. Next slide, please, Will. The PMT is a series of questions that COPE and other related grantees complete on a semi-annual basis. The questions address all aspects of the grant, including project team changes, stakeholder involvement, planning and implementation activities, outreach and training, encountered obstacles, and training and technical assistance receipt. Now, because the PMT was heavily modified in September of 2019, we did analyze the data as two separate data sets, the data from before the revisions and the data from after the revisions. We first ran descriptive statistics to understand and describe the grantees and their reported information. Then we conducted a series of repeated measures and independent samples, t-tests, and ANOVAs to identify any statistically significant changes over time and any significant differences between groups. We are now in the phase of evaluating and interpreting the results of the analyses and writing them up into a report. The report will include a description of our methods, a description of the results, any limitations that we had in our analyses, and recommendations for BJA as they relate to our research. And back to you, Janeen.
Great, thank you. And we will have several forthcoming reports, including a process evaluation report, as well as the analysis of grantee performance data that Mari just mentioned. But we will also, these will both be public. And lastly, we'll have a final comprehensive report that reports on the impact of the COPE grant program in equipping communities to address the opioid crisis, which will draw on the two previous analyses and report lessons learned and provide recommendations for policymakers and program developers going forward. So thank you.
Thank you. I have to say that is some very impressive baton passing between all of you. It was like I'm listening to the presentation, but I'm so like captivated by your practice in passing that off. Bravo.
Yeah.
So we are scheduled to have one more paper, the legalization of cannabis in California cities. I'm not sure if our presenter is here or not. I guess the joys of an online conference. If you're here, could you post something in the Q&A for me? Otherwise, we will just move on to questions. Okay, not seeing anything. We can just go ahead and start with questions. So Johannes had one for Ben. I guess you could just ask this yourself, Johannes, if you want to, live, if you're there.
I've been in person.
There he is.
Hi. So Ben, thanks for the paper, and I appreciate the amount of work you tried to condense. And I am not a de-incarceration expert by any means, but I just wondered if we need to expand how we think about de-incarceration. Because when I think about it, people who are currently in prison and what is a strategy to help them not be in prison anymore while keeping communities safe. Your research seems to suggest that's not going to work if we want to address overrepresentation. So do you have any thoughts about what that might mean for expanding pre-charge diversion or even rethinking arrest and when that might be needed? Because it seems like once people are in the system, whether to arrest or charge, it's very hard to get them out.
Right. So one thing that's helpful to answer that question is to get a better sense for why it's so hard to decrease racial disparities in prisons, and it comes from two basic facts. The first is that in American prisons, Black prisoners are overrepresented relative to white prisoners by quite a large margin for virtually all crimes, but they are even more overrepresented for violent crimes. So what happens is when you try the public discourse is all about starting with decarcerating low-level offenses first. And when you do that, you necessarily are decarcerating the crime categories for which actually there's less overrepresentation, in which case you are going to increase Black overrepresentation by doing so, just mathematically. And so I think there's a few things we could do. One is we could prioritize decarcerating violent offenses, which I think lots of people would struggle with, especially as a first order thing. You might want to do some of the other offenses first. And then if you're not going to do that, then you can, other things on the table include more race conscious sentencing strategies which I think right now are probably completely off the table given the makeup of the Supreme Court, but aren't necessarily. Like, there are other visions of the Equal Protection Clause that don't foreclose these kinds of strategies. And finally, but given how big of a hill there is to climb there, given the makeup of the Supreme Court, particularly now, even more so now than ever before, I think you're right to focus most on probably policing. So policing strikes me as the best place to decrease Black overrepresentation. The reason being that we can engage in certain strategies that would decrease certain kinds of policing strategies that lead to more arrests and more incarcerations, particularly ones that we might be less concerned about than others. I mean, I think that's probably the best way to do it. Doing diversion in the way you've just suggested is also a potential strategy, but you have to be careful to be sort of keenly attuned to the racial makeup of the people that you're diverting. It may just recreate the same problem I was describing a few minutes ago. And I should have started with the caveat that the reason I'm talking only about white and Black people in this analysis is that, in my view, the quality of the race data for other races is not good enough to do an analysis on. But, and that's what's limiting me from talking about other racial groups.
Thanks, Ben.
First time today, I forgot to unmute myself. So another question, as questions come in for Ben, one came in from Andrew Gonzalez for the Urban Institute team. Can you speak to what you're finding for the public safety data sharing partnership grantees? Are there any initial results for that?
Sure. Yep. I can, sorry, this is for Urban. Yeah, I can just jump in here, which is sadly an unsatisfactory answer, which is just at this stage and with the funding through the Bureau of Justice Assistance, we're not yet ready to share our preliminary findings, but we will be publishing them on our website relatively soon in the new year, hopefully, and can certainly share that out with the listserv related to CrimCon. So this is more just an update on kind of our process, and that findings will be coming, but apologies not to share those out at this time.
No spoilers today, in other words.
Exactly.
So thank you. A couple more questions for you, Ben, in the chat, if you can see them. So when you're talking about reducing the prison population, are you assuming that the crime rate decreases in a similar magnitude?
Yeah, so this is a really tough part of forecasting prison rates. One of the problems is if you are going to dramatically decarcerate, a lot of criminologists think, not everyone thinks this, but a lot of criminologists think that you're going to increase the crime rate for serious crimes. And if that's true, you may have a kind of weird feedback loop where by decarcerating, you increase serious crimes, which results in more prison admissions. And I think that might be the question, that the question that you're getting at. So as far as I know, no one has tried to deal with this problem yet. It means that any estimates in the literature about the effects of decarceration on the prison population are overestimates because you're failing to account for the fact that by decarcerating, you're going to increase crime and therefore increase prison populations. This is a really tough nut to crack. The way that I handle it in the paper is first by acknowledging that the marginal effects of incarceration on crime are right now, probably their all-time low. So our prison rates are so high based on what the literature finds that decarcerating 25% may not actually change the crime rate very much. That's one nice point to have. But if you decarcerate by 50 or 75%, the literature can't support that. So then the next thing that I do is I basically try and take what I think are the most reasonable estimates of the effect of the incarceration rate, the total incarceration rate on crime rates, and then incorporate those elasticities into my estimates of the number of admissions per year. Obviously, I can't do this with any level of precision, but the idea is like, let's take reasonable estimates from the literature and see whether it dramatically changes the results. And the answer is it substantially changes the results, but it doesn't dramatically do it. So for example, let's say I have a model that estimates that a particular decarceration strategy will reduce prisons by 55%. Usually once I incorporate the effects of marginal deterrence, it ends up going to something like 47 or 46%. So a substantial change, but it doesn't, if we manage to decrease the prison population by 46%, gosh, that would be, what an accomplishment. And so, this is a problem, but maybe not an enormous problem for the paper.
And then another question for you, also from the chat, if you have factored prosecutorial discretion into your work at all.
Yeah, so I have not done, I don't know how to do that. I think if I could incorporate that into the models, that would be great. I think there is some evidence in the literature that prosecutors in some jurisdictions are charging in ways that are racially disproportionate. So there's some really nice evidence, for example, from the federal courts that suggests that prosecutors are filing mandatory minimums against Black defendants in higher rates. And if that's right, then, I wish I had more time to talk in my 10-minute presentation, but if that's right, then that would be, I think, a powerful place to also try and reduce racial disparities. I think that the strongest evidence that I've seen is in the federal system, which is responsible for a relatively small proportion of prisoners, but there's certainly also evidence that this is important in other jurisdictions too. I don't want to understate that.
Mm-hmm. Great. Any other questions for any of our panelists today? Okay, seeing none, I want to thank everybody again for coming out today. Thank you to all of our panelists for doing incredible work. Thank you for everybody in attendance for coming out this afternoon and spending some time at the first CrimCon. Those of you who are interested in sticking around on this stream for the 4 o'clock International Issues panel, please know that I have to shut down the webinar for recording purposes, and then we'll be restarting it around 4 p.m. Eastern. Thanks again, everybody. Really appreciate your work. Wonderful job.
Thanks, Andy. Thanks,
Thank
gang.
you. This was great.
Thank you.
Take care, everyone.
Take care.